Dr. Williamson, it's great to see you again. Thanks for joining us.
Thank you for having me back, Peter.
First off, what's the latest at Eisenhower?
So far, we're actually at a bit of a plateau, which is a little hard for us to explain because we really expected to see quite a surge from the Christmas, New Year holiday. And so far, we're not really seeing that. We tailed off a little bit from the Thanksgiving surge and now seem to have somewhat plateaued. So I'll take it. It's good news. We just don't know exactly where we're going to head from here. We still suspect there will be an uptick after Christmas. We know even among our employees that certain people were celebrating the holidays together and did come down with COVID. So my suspicion is it's just going to be a little longer than we thought before it begins to hit. But hopefully that also means it will be less severe.
Hopefully. Since the last time we spoke, you mentioned that there was a tent that had been put up to help with added space to treat patients. Has that been used at all?
Yeah, we have a tent outside of the emergency department that's being used really as a staging area as patients come in that we suspect may have COVID. We're putting them into that area so that we're sure that we keep COVID suspect patients and patients that are coming for non-COVID related issues to the emergency department, keep them separated as much as possible.
There are new reports coming out that the coronavirus strain that was first found in the UK may be more deadly. What can you tell us about that?
Yeah, it's really kind of an interesting dilemma. That the strain itself doesn't seem to be more virulent per se, but as we see it spread more easily, that's the one thing that seems to be occurring, is that it does seem to be more contagious. It spreads more widely. If you have more people get sick, you have more people potentially become hospitalized, and you have more people potentially dying from the virus. So it isn't more deadly per se in terms of the virus, it's that it's spreading to more people, and therefore at the same level of mortality, we are seeing more deaths presumably from that particular strain. The good news is at least that strain seems to still be quite sensitive to the vaccine, so we believe it will cover that very, very well.
Speaking of the vaccine, how is the effort going at the hospital?
So we have the vast majority of our healthcare workers now vaccinated. We've gone through nearly 5,000 vaccinations here for our staff and physicians. We had a pilot program to begin vaccinating the public, and that has gone really quite well. We're still making some adjustments to our plan based on the experience with the test subjects in the trial of doing this for the public. And we hope within the next couple of weeks to be live with vaccinating our own patients that are part of the Eisenhower family that have been treated here, because we have an easier way of registering those. Once we get through that, then hopefully we'll be able to continue to participate to some degree in helping to vaccinate the general public at large within the Coachella Valley. One of the challenges we have is that we have to remember the hospital is also treating patients with COVID. So as a vaccination site, it is not ideal really for us to be the main provider of vaccinations within the Valley, because the staffing that we need to do that are the same staff that we're pulling in to treat patients in the hospital. So it pulls us different directions at the same time, which is going to be potentially challenging, particularly if we do see a surge in patients.